So today I want to really have a conversation with you about dental implant. What is a dental implant and when do we need to get a dental implant?
Dental implants are a really good option for those patients that for so many reasons, either trauma, caries, and whatever the reason was, they lose a tooth or they lose several teeth, right? So a dental implant is technically a screw that is made of titanium and it goes into the bone and the gums, right? So by placing this, we can restore and have new teeth, either one or several pieces.
So basically, like before, I remember we used to put like bridge on the teeth, like we would cut the tooth next to the empty space and then make it a bridge. But now it's better to do implants, right?
Probably the last time that I placed a bridge was maybe 25 years ago. And the reason is why I don't like bridge, even though they're still doing it, right? And I would say it's probably a cheaper option. The reason why I don't like bridge is because you have to cut the adjacent teeth. Adjacent teeth means, whatever is going to hold the bridge, you need to cut that tooth, you need to cut the other tooth, and then put it something that is going to join both. That's what is called a bridge, right? To replace one tooth. So for me, as soon as I became a specialist and I knew about implants, that's the only thing that I place. And of course, unfortunately, implants have a higher cost, but of course, it's something that if it was for me, that's something that I will do instead of cutting my other teeth.
And how long is the procedure? Is it a quick procedure? It's like a half a day procedure, 2 hours? What is the time?
It has different variants, and not only the time of the procedure by itself, because sometimes placing an implant takes 5 minutes. It's super easy, local anesthetic, and it can be done in 5 minutes, 5 to 10 minutes maximum, right? But at the same time, it depends of if the patient has bone to place the implant. If not, we have to place the bone first, then let it heal, which takes 4 to 6 months. Then place the implant, let it heal, wait 4 to 6 months, and then the final restoration. So if you don't have sufficient bone, it can take up to 12 months. But if you have sufficient bone, the implant gets placed and we can wait 3 to 4 months and then put the final restoration. So going back to your question, if it's quick, it is quick.
It is quick. So basically the whole process.
The procedure.
Yes, and it takes around 6 months to get the whole crown in place. And usually, what are the maintenance things? What do we have to do to take care of the implant? Because I know it's super important to do that.
I tell all the patients, an implant is just like another tooth. You have to brush it, you have to floss it, you have to have evaluations every 6 months or every year just to make sure that everything is okay. There's different things that can affect the life long of the implant. And what I mean by that is, if you are eating popcorn and all of a sudden a seed goes in between the implant and your gums, the seed can continue going forward and down, and then eventually the implant can get lost. So that's so important that if there's an inflammation, if there's some pain, if there's any discomfort, immediately if you have an implant, you have to go back to your dentist or your specialist.
Well, that's so great to know. At Sonrisas, we do implants, right?
We do implants, we do bone, we do braces, but the reality is it's a great option for all of you guys. As I mentioned, it's been a long time that I have placed a bridge, right? I'm a specialist on implants and I'm a specialist on bone, and that's something that we really we're proud of. Mention that because in Sonrisas we're a multi-specialty clinic, and we have different options to how you can get that implant that you need. So it's so important for you guys to know.
And it's awesome for you to come and see us at Sonrisas. You get to meet our specialists here, and we can't wait to see you
at Sonrisas.